Now we have a keynote speaker, Technology Fixing the Challenges of Healthcare Management. So how technology can be leveraged to address the challenges of healthcare management and bring digital solutions in healthcare organizations, such as telemedicine and remote patient monitoring with the help of artificial intelligence and machine learning. And the speaker is Luciano Tourn, CEO and co-founder of Wúru. He's an industrial engineer. He completed an MBA and has dedicated the last 10 years to developing enhancements in health benefits via technology. In 2018, he co-founded Wúru. Welcome to the stage, please.
Hi, everyone. Well, this is a challenging moment to give a talk after just having had lunch, so hopefully I will engage you all. I have confidence because we have just won the 3rd World Cup, so that gives me a big boost to do it. Anyways, I need a click. Is this one? All right. So this is the roadmap we're going to cover. What I want to talk about is something that is very important nowadays, and it's the future of healthcare. First, the challenges. When I was a child, I used to roll my eyes when my parents told me that they didn't have color TV. And the same, now that I'm a parent, happens to me when my children hear me say that I grew up without internet or mobile phones to talk with my friends. I believe that if we fast forward 10 years from now and tell people the way we are getting healthcare services today, they will believe it's insane. This is a typical surgical patient flow. These are all the steps and the friction that he has to go through. Of course, getting an appointment through phone, then driving to a hospital or clinic, parking the car, waiting. Once the doctor sees you, he has to find a proper spot for the procedure that he needs to do on you. Then once he goes back and forth with the scheduler of the hospital, you have to come back many times to do all the pre-op evaluation. Then you have to, of course, fill paperwork, and then the surgery is going to be canceled. You have to reschedule that, and once you arrive to the hospital finally that day, and I'm sure many of you have felt that, you are very vulnerable. You feel alone, and what happens? You have to wait more. In this state of stress, you have to wait more. And then, of course, the surgeon gets into finally the operating room, frustrated because he is delayed, not in the best place to focus on your operation. Hopefully, everything goes well, you are discharged, and you go home. This way of delivering medicine has many, I would say, dire consequences. One is the shortage of health workers. The WHO estimates that around 10 million people will be lacking by the year 2030 in many roles, from physicians to nurses to hospital administrators. Then, of course, costs are rising. We all know that. People are luckily living longer with chronic conditions that require more services. And on top of that, around 20 to 30% of those services are wasted because of inefficiencies. Third, and very important point, there's a high inequality accessing healthcare because of geography, because of cost. Around 50% of the population doesn't have proper access to healthcare systems. In spite of all this complicated situation, I myself am very much optimistic, because during my lifetime, and yours as well, we have seen what happens when technology tackles the sector and revolutionizes it. We have come a long way. When you go to the hospital now, you leave a digital trail. All your data points are gathered. But unfortunately, only 3% of all those data points are used to make decisions that affect and improve your outcomes. 97% of our data sets are sitting idle in silos inside hospital information systems. They are waiting for AI and for advanced analytics to take on them. We are just starting. And I want to give you some perspective on why I think we're just starting. The COVID-19 pandemic was, of course, a tragedy, but for healthcare, it was a great catalyst of innovation, catalyst of adoption. I believe that COVID-19, the year 2020, was year zero for health techs. Of course, to extend the time frame, remember in the 1990s, probably some of you were not born there, but the consumer internet took on the world. And there were many companies, late 90s, beginning of the year 2000, that were revolutionizing industries. Like 10 guys in Argentina on a garage, they decided to build an e-commerce company called Mercado Libre. Of course, nobody knew them back then. Just 1% or less than 1% of the population was buying online. Fast forward 20 years, they are the biggest company in Latin America, and you wouldn't even think of not buying online. So you have to move now to 2022. We are 2 years into this revolution. Of course, if I ask you, what health tech companies do you know? Probably most of you don't know anyone. Probably Alice, that spoke in the other stage, is one of them. But that's not surprising. We are in year 2 of this revolution. And I'm particularly excited about tackling data and AI to improve healthcare. And I will give you 3 big areas where, in my mind, I classify what is the impact that we're going to see. First is clinical decision-making. There you have AI. This is the longer history that we have, like impacting clinical decisions. AI to improve diagnosis, reading images, AI to remote diagnose people in remote areas, AI to do triage, AI to do remote monitoring so you can do all your healthcare at your home, AI as a clinical decision support tool to physicians. Then we have non-clinical. Non-clinical is all the operations that is around the clinical act. That's basically taking notes, automating paperwork, administrative stuff, increasing the capacity of the OR, of beds, that is having more without having to build more hospitals. And of course, the virtual assistant that is growing more intelligence with ChatGPT and all those conversational AI models to real-time coordinate with the patient. And then the one that excites me the most is the human impact. Healthcare is a profoundly humanizing experience, and it's also a shared experience. All of us have been or will be through the healthcare system. It's a time of vulnerability, so anything that we can do to remove that stress, to help you navigate the complexity, is really huge impact. And also, bringing back the joy of practicing medicine. There's a reason for the shortage of health workers. It's the stress and burnout. Around 50% of professionals in healthcare are burnout or are about to, or they feel anxiety. And this can greatly be solved if we take out the 70% of time they devote to administrative stuff. So I believe that in the next 5 years, AI will reduce the spending in healthcare between 5 to 10%. That's the GDP of Spain, by the way, so it's a huge amount. So now I want to double-click on a specific area, which is AI for Ops. AI for Ops is augmenting intelligence for healthcare operations. It's a category that my company pioneered in Latin America and Spain when we founded it 4 years ago. It's basically using AI and advanced analytics to detect patterns, to detect anomalies, and to detect opportunities for improvement in the operational data in healthcare. It basically wants to achieve the right care at the right time with the right resources. And this category of AI for ops brings a new paradigm in terms of data. It's not so much about big data, like the sheer amount of data, but it's much more about smart data. What I mean by that, it's the right quality information in the right format for a specific use case. And I'm going to give you an example. So what we tackle at Wúru is the operational room workflow. That's basically all the different steps that you have to take in order for a successful operation. In a summary, we predict, given the procedure, we predict how long it's going to take, and we assign the optimal slot in the optimal operating room so that you don't wait, you're not delayed, you're not canceled, and also you deal with the highest efficiency in utilization. It's kind of similar of how Amazon decides how to ship packages given demand. Wúru automatically decides how to allocate the operating room given the demand for surgeries. So remember all that long checklist of frictions? Well, if we are able to optimize the operating room, we end up with this type of pathway. Conversational scheduling, no back and forth. Optimal utilization, no delays, no waits. Real-time coordination, so you don't have to drive back and forth to the hospital for all the pre-ops. You are automatically coordinated. The patient and also the physician. Perfect match. This takes complicated math. This is, as I mentioned before, such as the things that Amazon does, shipping packages, matching perfectly supply and demand. So in healthcare, it's matching human resources, instrumentation to the appropriate procedure. And then, of course, timely discharge. I hope I covered what I believe is going to be the future, but then I want to narrow in two important points. One is the perspective on growth. I'm convinced that in the coming 10 years, we're going to see that the biggest company in the world is going to be a health tech company. But not a current health provider, not a current health company such as Amazon. This is going to be a native health tech company, consumer obsessed, that's going to completely reimagine